Hi, I'm Jade from Jacob Steele, and today I'm going to be speaking to Katie Glover from coastal West Sussex Mind, all about how you can be looking after your mental health and well-being during lockdown. So let's go. Hi, Katie.
Hello, Jade. So, May 1970, two people set up Worthing Mind. They were from an office in Worthing Hospital. And yeah, so 50 years on, we've got about 80 staff now, kind of working across West Sussex. We're a local mental health charity, and we are based in Worthing, but we work across West Sussex. Provide support to anyone really who wants to reach out and contact us. We have specialist staff that work with young people and also older adults and families. And if people contact us, we give advice and information. We can also offer ongoing support to people as well.
Yeah. Have you found that there has been an increase in people contacting you since lockdown started, or is it much the same as it was?
So for the first few weeks, no, not particularly. We hadn't seen an increase. I think that we are absolutely expecting there to be a significant increase over the next few months. But I think what we've seen, and I think it's a thing in the general population, that a lot of people are kind of almost like being very stoic and kind of feeling that it's just something they've got to get through. The longer it goes on, I think the harder it is for almost like people are trying to hold it together. And the longer that goes on, I think the harder it is for people to do that. Mm. Also, we're expecting that once it kind of eases up a bit, that's when a lot of the stuff that people have been almost not dealing with, because they've been just kind of thinking, I've really just got to get through this, will start to come out a bit more. I think one of the things that's really important at the moment is that it's a very difficult situation for everybody, and feeling anxious and worried is actually normal. Kind of normal response to a difficult situation. And so I think everybody, irrespective of whether you've had mental health problems or you're struggling, we all need to look after our mental well-being at the moment. And the kinds of things that really help people are not rocket science. They're kind of quite obvious in a sense. So things like being active, sleeping properly, eating properly, doing things you enjoy, and trying to find a kind of way to stay connected to people. They are the things that help people to look after their mental health. And we all need to be thinking about that in the same way that I know everyone's thinking about how can I stay physically well at the moment. I think we all need to be thinking about how can I stay, mentally well. If you are struggling, to ask for help and not to feel ashamed of that, to actually make sure that you're talking about how you're feeling and kind of getting it out. So not bottling stuff up inside, making sure that you're sharing if you've had a really horrible experience or you're frightened or worried, that you're kind of talking about that. And actually things, if you're not sleeping well or you're finding it difficult to eat and things like that, they're usually signs that maybe that stress has got a bit more serious. And that's a time maybe to try and get a bit of help, and things like counselling or talking to someone at Mind can really help with that as well. I think there's something about, for all of us in the community, and actually what we've seen is fantastic, that people are really caring for each other. And I think if you're worried about somebody or concerned about somebody and their mental health, that don't feel afraid to talk to them about that. Don't feel afraid to ring somebody like us at Mind and say, I'm worried about my neighbour, I'm worried about my friend, and get some advice about that. And to sort of, I suppose, to sort of take that, you know, be part of that community response and kind of be part of looking out for other people. Because I think one of the things at a time like this, only for a very small number of people, but it does put people under a lot of pressure. And we're concerned about the risks around suicide. And so wanting to raise awareness around suicide and to support suicide prevention in our community is really, really important. Don't be worried about somebody and not do anything about it. You better to be worried about somebody, do something, and then upset them, or actually they're fine. It's much better to do that than to not do it, because during this time there will be people who will find it really, really difficult, and where those kinds of thoughts may be going on for them. And so actually being brave and doing something about it is really, really important. We've just got some funding from the councils in West Sussex, and also from a trust fund as well, to provide free online suicide prevention and awareness training, which you can find out about on our website. And that's open to anyone who's volunteering or working in any kinds of support services in West Sussex. So doing shopping for your neighbours and things like that. If you're doing something to help other people during this crisis, then if you wanted to, you could do that training. I mean, one thing is people can donate. So there's a donation button on our website, which is pretty easy to find on our website. People are kind of coming up with kind of quite creative ways of doing fundraising activities during social distancing and lockdown. If people have got ideas about fundraising activities they'd like to do for us, we'd really, really welcome that. And we're still able to drop off t-shirts and buckets and things like that to people. So we've adapted all our services we're offering phone and video call support to people. Is that we've had to change the way that our phones are operating. So actually the best way to contact us at the moment is to send us an email, and then someone will come back, because then that first contact that you have with us, that person will have the time to talk. So
if somebody contacts you, what could they expect?
Well, first and foremost, they can expect that they'll get someone on the end of the phone who will be friendly and kind, and we're actually, the main thing is that they'll get someone who will listen to them. When someone contacts us the first time, is just ask them how they're feeling and what's going on for them, and try and give them the space to kind of tell us about that, and to listen, and to make sure that they have the time to do that. And I guess one of the things, obviously, when people are struggling with their mental health, they can go to their GP, and sometimes that's the right thing to do. But in a GP appointment, when you've only got kind of your 8 minutes or 6 minutes or whatever it is, whereas, you know, we will take as long as that person needs to have that conversation. Then we can give advice and information